AHEADinVET, which stands for Vocational Education and Training, is an Erasmus Plus project co-founded by the European Union that aims to upskill VET teachers and trainers in dealing with mental health of their learners. You are listening to the AHEAD in Mental Health, Navigating Mental Health in Vocational Educational podcast. AHEAD in Mental Health, Navigating Mental Health in Vocational Education is a podcast series that delves into issues related to the mental health of trainees and trainers in the VET sector. Experts in the field of mental health and VET will be sharing their experience and expertise, allowing us to gain a better understanding of the mental health topic. I am Elisa Borrione, project manager of this project, representing Excelia in the consortium. Thank you for joining us and enjoy. Our guest for today's episode is Sofia Triliva, Professor of Clinical Psychology at the University of Crete. She will help us discuss today's subject, innovative approaches to supporting VET students' mental health. Thank you for being with us today, Sofia. Now, as with every episode of our series, will you allow me to lead the discussion with some questions I've gathered on the subject?
Okay.
Thank you very much.
Thank you for inviting me, and I'll be very happy to answer your questions.
Thank you. So the first question is, what are the current challenges and limitations facing VET students in terms of their mental health?
Okay. According to the latest research, young people 15 to 24 years of age have the highest prevalence of mental health problems compared to all other age groups. Mental health difficulties are often an outcome of experiences with various psychological stressors encountered in social and environmental settings. Students in vocational education and training confront many demands and challenges that can increase the stress levels that cause psychological dysphoria. In Greece and perhaps in other countries, vocational education and training is undervalued. The main characteristic of the Greek family, and consequently the Greek society, and this may hold for other societies also, was and continues to be the demand for general education and university academic type of studies as opposed to vocational studies. Vocational education is not in high demand in Greece, unlike other European countries. It is considered a solution of necessity, especially for students with low performance or expectations. This state of affairs results in the stigmatization of the vocational institutions where students may be enrolled, and consequently of the students themselves. Stigma is one of the main challenges the VET students face. In Greece, they are often identified high-risk or at-risk groups. For example, students with low socioeconomic backgrounds, those residing in rural and remote areas, lesbian, gay, bisexual, transgender, and diverse, intersex, and queer or questioning, and other LGBTQA plus students who may also encounter the challenges. The students, especially from the rural areas and from these type of backgrounds, have faced more social and environmental stressors that can impact their mental health. Stigma in Greece, in particular, is quite high. So this makes the students more susceptible to such problems. Other challenges occur when students finish their compulsory education and need to decide on their immediate future. They may need assistance in making the vocational decisions. That is an important challenge where the demands of autonomy, self-management, and responsibility render the level of uncertainty, insecurity, and stress much higher. And this type of adversity or difficulties can impact students in a very noticeable way. So, in this respect, the lack of self-awareness, self-determination, and intrinsic and extrinsic motivation can determine the student's commitment to the learning process in VET programming. That means students, in essence, may not be so prepared to enter such type of programming, and they may have made wrong decisions. Several of these problems have increased since the recent COVID-19 pandemic, where young people have experienced more social and psychological problems. They may experience depression, feelings of loneliness, changes in communication habits, sedentary lifestyles, or an abuse of technology or substances, psychoactive substances, all of which can influence their sense of self, their perception, their quality of life, and their academic performance. So students may be ill-prepared for the programming offered at AHEADinVET institutions. In addition, vocational education and training provides students with different practice-oriented situations and practica, where they may feel that there is a mismatch of their skills and abilities and their choice of VET programming. Moreover, in VET institutions, students are placed in challenging simulated situations that are close to actual work experience, which may cause students to feel pressure or insecurity when performing certain tasks or essential technical skills in their field of work. Other related factors could be relationships with peers or the classroom environment, learning difficulties, or adapting to change brought about by the standardized educational model. Vocational education and training settings can be better utilized to improve the mental health of their students. These settings are well placed to engage in primary and secondary prevention, as well as facilitating access to tertiary interventions. For example, ensuring access to appropriate information regarding prevention programming and services for students experiencing high levels of mental health difficulties and mental health challenges. Improving the mental health of VET students in educational settings could result in substantial social, economic, educational, and health benefits for many young people and their families, but also their communities and the social and cultural space at large.
Okay, thank you very much. That was very interesting. And considering what you already mentioned, how do you think traditional approaches to mental health support in the VET sector is falling short?
VET institutions are increasingly welcoming a large number of students who may be the first in their family to attend such a tertiary education institution and who are from a lower socioeconomic backgrounds and who are mature age students at times or who belong to other vulnerable at-risk populations. Hence, VET settings are oftentimes not so mindful with regard to programming, the type of programming the VET institution can offer to the students. Such programming needs to be mindful of mental health inequity for at-risk population groups are more likely to enter, at least in Greece, but maybe in other countries also, VET types of training. Despite increasing enrollments and the growing evidence of the mental health risks for tertiary students belonging to at-risk groups, there is low provision of targeted mental health prevention and treatment for these students in both VET settings, but also in other settings. Barriers for at-risk students are many. There are a range of concerns about access to mental health support services for VET students, especially those belonging to at-risk groups. A systematic review of barriers and facilitators to mental health care among at-risk groups suggests that many vulnerable young people experience heightened barriers in seeking support services. Hence, we have a large population of students at VET settings and institutions, and where they're not seeking services or the services are not available. Hence, there's an underdeveloped potential of mental health promotion in VET settings, reaching young people, especially men and other at-risk groups. Point out men as opposed to women, because although women may experience higher levels of stress and depression in the general population, and men, on the other hand, are the ones that seek help at much lower rates. So basically, VET institutions, in order to meet the needs of students, need to find new ways of providing services and also to provide prevention services for students who are enrolled in such institutions.
I understand. And what innovative approaches have been developed to support VET students' mental health, and how effective have they been?
That's a good question. Effective interventions and approaches to improve VET students' mental health are not well researched. So it is very hard to find evidence. And these days, people in the mental health field, providing services in the mental health field, are urged to provide evidence-based interventions and need to provide evidence-based interventions. That is, interventions that have proven to be effective. So these are not very well researched, and there are some recommendations made, but they relate to interventions and approaches offered to students at large, but not necessarily VET settings or by tertiary education institutions. So basically, we have little knowledge from the field of VET education. So the following interventions that I'm going to mention have been implemented in virtual or non-specific settings that have shown positive effects on tertiary education students' mental health outcomes. They include on-site counseling interventions, for instance, offering counseling programming for students that seek it out or ask for help. Such counseling interventions could be mindfulness-based interventions. Other interventions that do not focus so much on what's considered therapeutic are physical activity, exercise, sport, and recreation interventions. Other interventions, again, that are not focusing primarily on the aspects of mental health are dietary interventions, and of course, digital approaches that could intervene in all types of activities, from sport all the way to mental health interventions. Hence, it is very, very important to develop different types of interventions for this population, but also to research how effective they are. Effective interventions and approaches to improve students' mental health in vocational education settings can and should offer engaging curriculum and learning experiences. Hence, the setting has to have an engaging curriculum and learning experiences where the students not only learn about their training in a specific type of field, but also learn about mental health and understand how mental health basically impacts people's lives. They also institutions need to cultivate supportive social, physical, and digital environments. The digital world has become the new place for providing services for mental health awareness and mental health support. Thirdly, vet institutions need to strengthen community awareness and actions. And when I talk about community, I'm talking about the institutional community at the educational facility. Teachers, professionals who are teaching in these institutions, instructors need to be aware of the mental health concerns that students may have. Sometimes they need to be able to diagnose or somehow become knowledgeable about different types of problems a student may face and be able to ascertain that these are the problems that this particular student or several students are confronting. And they need, once they ascertain this, to know what actions or what can be in place in order to support the students. Also develop students' mental health knowledge and self-regulatory skills. And again, this can happen not only from having on-site services, but also from including curriculum education about mental health issues. A fifth possible intervention is ensure access to effective information and services. Okay? What services are available on-site? What services are available in the community? What services are accessible to everybody, and what services are accessible for specific groups. And lastly, curriculum-based strategies are very, very important. I mentioned them before. I will be a little bit more clear as to what curriculum-based strategies are. Basically, these types of strategies are based on what can be called health enhancement programming. Okay, they are higher education settings interventions right in the classroom. This type of program has been very effective, teaching students about health, and in this health field, learning about health problems, but also, of course, learning about mental health problems, which is part of the health curriculum. So a holistic community-based framework is what I'm proposing, a framework that is structured around 6 principles that support student mental health and well-being. First, the student experience is enhanced through mental health and well-being approaches that are informed by students' needs, perspectives, and the reality of their experiences. We have to be aware of students' needs, have ascertained their perspectives about what their needs are and what mental health means to them and how they could best be supported. and what are the realities of their experience in the institution that they're being educated and trained. So this is one of the first recommendations. Secondly, all members of the university community contribute to learning environments that enhance student mental health and well-being. That means that as educators or as instructors, we must be aware of student needs, especially the students that come from diverse backgrounds and students that may come from backgrounds where there may be risk for their mental health and well-being. A third way of supporting is mentally healthy education and training communities encourage participation in the community, foster a diverse, inclusive environment. So we're very mindful of the language that we use, of our own biases as instructors, and how bias can be talked about and understood and communicated in a way that makes students at ease with their own ways of understanding bias, but also help students to understand that bias can be detrimental, not only to the student's own mental health, but also to the mental health of the entire classroom and environment, and of course the community. Also, again, in this mental health education and training community approach, the vet institutions need to promote connectedness in the institutional community and support academic and personal achievement, help students to achieve academically and personally. And fourth, the response to mental health and well-being is strengthened through a collaboration and coordinated actions. A mental health service cannot do all this. This means that the institutional setting needs to be focused on mental health and well-being and be capable of collaborating and coordinating their actions. We see a student, for example, that maybe warrants help and support because of stress or because of depression or because of other issues. And the people within the community will be able to identify this and help the student to get the help that she or he needs. Students are able to access appropriate, effective, timely services and support to meet their mental health and well-being needs. This is very, very important. Mental health concerns, once they become chronic, students may not be able to get the immediate help that they need and may escalate into more difficult problems for them. Lastly, the sixth aspect of this type of a holistic approach is a continuous improvement and innovation, which is informed by evidence and helps build an understanding works for student mental health and well-being. Each institution, but also the scientific community that conducts research, but we need to conduct research also in specific settings sometimes in order to have the more specific knowledge about the group that is attending and matriculated in the institution. So continuous improvement is very, very important. And this continuous improvement comes about when we have evidence about what is going on with our students, and psychologically, socially, and with regard to their achievement in the educational setting. And then if we monitor this and have such feedback, we're able to provide the necessary services in a timely way.
That's extremely interesting. And what are the benefits of these innovative approaches compared to traditional ones?
Yes, vet students endorse high rates of mental health problems. So while many training programs offer services, many students who could benefit from mental health services do not receive care, most probably because nobody has seen that they need these services or they themselves do not seek help. Indeed, nearly half of the students who screen positive for depression, for example, do not receive treatment. Innovative services could be digital mental health programs, such as those delivered by mobile apps. And most students have cell phones nowadays, and this could be right on your cell phone. You get the help that you may need, can expand access to the mental health care and resources. Okay, so if mental health services are not available within the institution, there need to be outreach programming, as I said earlier, either in the community, but also the digital mental health programs. Mental health also can be peer work, which can also benefit vet students. Hence, if the community is working in a coordinated manner, all kinds of services can be accessed and very readily. Okay. Other supports include academic support for students, through service learning. Service learning is a unique type of programming where the student not only works in the classroom or does lab work or hands-on type of work within the setting, but also goes on to the community. This helps the students develop not only skills that are necessary for their type of work that they're being trained in, but it also helps them engage in the community and learn from people working in the settings where they may be working later. It helps them connect to a social network that could help them find jobs later on. So service learning is, I think, especially for vet students, but also for tertiary education in general, a very beneficial type of programming that can help students engage beyond the classroom and beyond the institution into the community at large. Connection to community support and counseling is also very important, and there are many more community supports in the greater system, the community, than they are within the educational institution itself. Counseling service in the community, but also the service learning helps students to form and sustain positive relationships. They learn from people in the community. They give to the community through the services they provide, and they expand their ways of learning and understanding, and especially of what's going on in the social world or in the service sector where they're going to be working. Other type of supports include pastoral care, which is basically for students that need specific type of support, be it financial, be it emotional and social, be it support in learning. Right? This type of pastoral care support means that we see the student as a whole person who needs specific type of services that can be gained through the community or through the institution where they're being educated. And also the provision of well-being and prevention awareness, very, very important in the institution itself, in the vet institution itself, or basically in the community. Students are connected, form relationships, do not drop out, and are more aware of their needs and coping strategies through such programming. So fostering community engagement, either through service learning or other means, is especially crucial for the students' well-being and education. Community services are also appropriate wraparound support available for vet students. The wraparound services means that there are ways of basically providing different types of services at different points in their learning process. And these services are available to the students when they need them. Online services and apps provide support for students who do not readily seek face-to-face support. And just making the students aware of what these online apps are and how they can be used means that the students can access these supports at any time. Technologically administered services can be free or at a much lower in costs as compared to in-person services or services that may not even be available. Hence, new types of programming can be very beneficial, especially because they can be accessed at any time, and also because they engage the student with the community, depending on the type of programming that it is.
I understand. And how do you think a VT institution can encourage to adopt these innovative approaches?
I think awareness, basically through providing awareness, seminar type of workshop, type of information about what services are there available for students that are technologically based. Okay, so teletherapy provides access to professional help from anywhere, increasing accessibility to help, and this does exist. And then if teletherapy is not something that the student could seek out, mental health apps offer tools for managing stress, anxiety, depression through guided meditations, mood tracking, and cognitive behavioral techniques. Hence, even if we don't go to the therapy section of providing services, this could happen through mental health apps. Digital technologies are proven to be very helpful to improve mental health care in the following ways. First, they are portable devices such as mobiles, tablets, and smartphones that are used to entertain and relax anywhere at any time. So students learn about anxiety and how we combat it through them. Vet students who are facing social emotional challenges can use these devices to help balance their mental health on their own and to become more aware of how relaxation can be a tool, and not only a tool, but also they learn specific techniques which they could use at any time, even if they don't turn on the app. So basically, they're trained to use specific techniques to help assuage their emotional or other issues that they're facing. Then there are virtual events. That's the second type of help. Virtual events. The rise of virtual events has been rapid, especially during the pandemic. Virtual events such as exercise videos and other types of videos in learning about your work or even mental health in general are a great way to stay fit and also help reduce anxiety and depression. So these virtual events happen online. There are virtual groups online for specific issues that students may be confronting. And this started during the pandemic because such virtual mental health events did not exist so much before that. So they continue today for people that are, are less likely to seek help face to face, or either because of financial difficulties and barriers, or because of barriers that have to do with distance and the like. There's also voice assistance in the world of technology. And the thought of talking to another person about a problem is a barrier for many people, due to which chatbots are frequently used nowadays. For an example, you can talk to Google or Alexa and share your problem with them. So you talk to a chatbot, and they are happy to provide tips to overcome your problems. With AI today, this has gone beyond. You could even get help for more nuanced difficulties, more psychological problems, because you type a question and you get an answer. It's just that Google and Alexa speak back to you. So mental health chatbots provide a friendly atmosphere. They can help young people to share concerns and worries, especially young people that are not likely to seek out help from professionals or from other people, and not likely to open up about the problems that they're confronting to people that will listen to them. Another way that technology can help is through applications. These days, there are applications that are specifically designed to relax the human mind. They can be games, short movies, therapy that focuses only on maintaining mental life balance. Okay. For example, meditation apps offer exercises that help to improve breathing, and in turn helps people to relax and improve their sleep problems. Okay. Basically, these are some of the many, but I pointed out those that have become very popular nowadays in providing teletherapy or mental health care through technology.
Well, this is enlightening, and I think this answered our next question, which is how can technology be used to enhance and improve mental health support for VET students?
Yes, technology, as I mentioned, several forms of it has been used, is being used, and there are apps available for people that are confronting the challenges of addictions. There are apps available for people confronting anxiety issues. There are apps available for depression. There are apps available for people with difficulties in diets and eating. There are apps available for tracking all kinds of issues that create stress or bring about anxiety in people, and also other issues that they may have that are mental health related.
And do you have some examples of technology-based mental health support tools and resources for VT students?
I talked about the chatbot, which is very important, but there are these applications. I can't say more specific which ones there are. I know very, very well that there is a relaxation applications online and apps online for relaxation. I know that there are watches that tell you not only sports and activity type of issues, but also your heart rate, your eating, your sleep pattern. Okay, so all these are available. Some of them are available through expensive technologies like the watches, some less expensive, some more expensive, depending on what you're seeking to resolve or take care of in your mental health issues or support. But there are very many that are not expensive and are readily available online. Many universities, not only vet institutions, but universities, academic institutions, have a very large display or technology-based types of resources right online with just one click to the link, and you have a tape on relaxation.
That's very, very interesting. Now let's see more specific examples of a VT institution that has implemented innovative approaches to support the mental health of its students. How were the innovative approaches implemented, and what were the challenges faced?
First of all, the major challenges faced all the time, everywhere, for applying mental health services in general. The institutions really do not have the budgets for such services. Now, and also that means you need to have a whole service set up for students, and this is not easy to achieve. Hence, very little research on vet institutions and how they are meeting the mental health needs of students. But in higher education, more recently, institutions are applying what's called the STEP services. Okay, they have first of all, they're trying to apply holistic, as I mentioned, community-based programming. And by community-based, I mean in the institution and then the wider community if possible. And they also provide services through what's called considered STEP program. STEP programming basically means that you have a service that cannot provide all the services needed to students, because there are some students that need very specialized services, or they need services that the counseling center or that service sector cannot provide for all the needs of the students. So what they're doing basically is saying, okay, this is a student that needs not only psychological support, but also psychiatric support. So we will basically refer out into the community for the student that needs more than 3 or 4 meetings with the professional who is providing services at the institution. Then there are services that there are students that may be basically informed about what are the apps that can be used. Or there are services that are provided in a group level as opposed to an individualized level. Okay, so, and again, most institutions nowadays, this is both academic focused and vocational focused institutions, need to seek out what is available in the community and know and educate their staff to identify problems and educate their staff to see what students are at risk for severe or more severe mental health problems, and try to see where these students, and basically refer out if the services are not available, or on the other hand, in what are the services available within the institution itself. So what's going on right at this juncture in many higher tertiary education institutions is bringing both instructors and the personnel that work at the university, helping them become more informed about mental health needs of students, keeping track of what the mental health services needed and how students are provided or not, or cannot be provided some services, and what needs to be in place then to help the students, or where the students could be referred to. At this juncture in Greece, but I think it's all over the world, according to research, there are more mental health needs than can be met by mental health professionals. So there are long waiting lists for many providers of mental health services, either be it public sector or be it non-public sector services. So, and also services are more and more expensive, and both provision and maintaining the service available and open to many more people. So these are the difficulties that the institution needs to basically bridge. First, offer what's called step type of programming, where you see what are the needs of the population, how many of these students can be supported within the institution, where in the community supports are available, how do I educate instructors and staff to understand, to be able to identify problems, how do we work in the curriculum to provide students with understandings about mental health and in some ways provide services that are preventive in nature. And also become more cognizant of all the online types of services that can be available. This basically entails holism and community perspectives in learning and in well-being. Okay? So we cannot see the students as being the problem with their problems. We have to see how the system works as community, as a whole, to identify needs and be able to provide the services needed, if not within the institution, within the community at large.
I understand. And what have been the results and impact of these approaches on the mental health of the students?
As I said, they're not from VET institutions, the results, but the results from other tertiary education facilities point out that it is a way to function. It is a way to meet mental health needs. It is a way, and some of the services provided are effective.
And what lessons can other institutions, VT institutions or others, learn from this case study?
The lessons are, how do we work in identifying needs? How do we work as a community that cares? How do we point out to students that they matter? How do we help students engage with the curriculum, not only the type of profession that they're studying, but also engage in the curriculum by bringing it a step further through service learning, going to the community to learn from the community and to give to the community? Because community engagement, either within an institution or with a wider community, means that the student is connected, shows the student that the student belongs within the institution and within the community. Basically enables the student to somehow feel a sense of belonging, no matter how different they may feel or whatever type of stigma they may have experienced. So mattering, community that cares, community that is well connected and collaborating to meet the needs, not only of specific sector of the population, but for the community at large. Right? So basically, holism and community perspectives benefit learning and well-being.
Our guest for today's episode was Professor Sofia Triliva. Thank you very much, Professor Triliva, for joining and sharing with us today your knowledge and experience. It was extremely interesting. I am Elisa Borione, Project Manager of the project, representing Excelia and the consortium. Thank you for listening to the AHEAD in Mental Health, Navigating Mental Health in Vocational Education podcast, a series produced in the framework of the Erasmus Plus project AHEADinVET. Remember, mental health is an issue for which conversations need to continue, evolve and flourish, and together we can create a more compassionate and supportive VET community. For more information about the project, feel free to check out our project channels and follow us on Facebook, Instagram, Twitter, and LinkedIn. Find out more on our website, AHEADinVET.com.